Across several networks and streaming channels, you can find dramatic depictions of life in a hospital.
Usually it's in the emergency department where stress and chaos can boil over. How accurate, though, are hospital TV shows? Good question. Jeff Wagner talked with the professionals whose daily grind can make for good television.
The waiting area beyond these doors and a quiet room after that is what most patients see when visiting the emergency department.
What do we got?
But what grabs attention on TV are the intense and at times incomprehensible moments that make for an entertaining story.
I mean, I watched Grey's Anatomy, and now I know that that's like incredibly not realistic.
Erin Carl is a staff physician in Hennepin Healthcare's emergency department.
There are a few that the medicine kind of aligns with, like things that we do in real life.
Christian Erickson is a registered nurse.
What elements do these shows often portray accurately?
The teamwork and like the camaraderie, working very closely with everyone from not just the physicians and the nurses, but the pharmacists to even like the environmental service personnel who like clean our rooms every single day.
Maggie.
Yeah.
We need to prioritize surgical candidates. Where are they?
Everywhere.
Is it as chaotic as they sometimes portray it?
Yes, definitely.
We did Dr. Carl's interview in the stabilization room, where the most critical patients are taken, often after an ambulance ride. It was empty then, but at times there could be up to 4 patients in there getting treatment.
But most of the time you have, a critical case, and then you're going to help a patient with abdominal pain that's fairly stable, and then you're going to meet a patient with wrist pain, and then they're fairly stable, and then you run a cardiac arrest, versus in the shows when it's like critical.
When you're finished with him, see a little old lady with leg pain and 6. Got it?
As for what else these shows often get wrong,
there are a lot of older medical TV shows that portray like either nurses doing things that nurses don't do, doctors doing things that doctors don't do.
But the medicine is like truly accurate, I would say, especially on shows like The Pit.
But please keep your eye on that waiting room. Make sure nobody's gonna die out there.
The Pit TV series on Max highlights a single chaotic day in an emergency department. Healthcare workers say it's so realistic, some are too traumatized to even watch it.
But they also captured a lot of like other themes in healthcare that I think are really important right now for like the public.
The show highlights the hospital's lack of beds, overcrowding, and low staffing to manage it. Problems happening in real life nationwide.
Other hospitals are managing this crisis, either step up or step aside.
What would you say to the average person who doesn't work in an environment like this, who is watching the show?
If you're emotional watching this show for 1 hour at a time, imagine how like tiring and emotional it can be working in emergency medicine in America right now. And that's like our life every single day. And so really giving healthcare workers some grace.
With photojournalist Jose Pascual, Jeff Wagner, WCCO News.
Other hospital shows praised for their accuracy include Scrubs and Chicago Med. Grey's Anatomy and Housefall are on the other side of the spectrum.